How do you manage Duodopa infusion tube dislodgement for Parkinson's? If you or a loved one are using Duodopa therapy, knowing what to do if the tube becomes dislodged is important. Duodopa involves delivering medication directly into the small intestine through a surgically placed tube called a PEG-J tube. Sometimes, this tube can move out of place, which needs quick action to keep the treatment working and prevent complications. The first step if the tube dislodges is to stop the infusion pump immediately. This prevents medication from leaking into the abdomen or skin, which can cause irritation or infection. Once the pump is off, contact your healthcare team or emergency services right away. Dislodgement is a medical issue that requires professional assessment and intervention. Medical staff will evaluate the situation carefully. They may perform an imaging test, like an X-ray, to confirm whether the tube has moved or come out of place. Signs of dislodgement can include a sudden return of Parkinson's symptoms because the medication is interrupted, or symptoms like abdominal pain, leakage around the stoma, or visible displacement of the tube. Usually, a specialist such as an interventional radiologist or gastroenterologist will replace or reposition the tube. This is often done using endoscopy or imaging guidance to ensure the tube is correctly placed into the jejunum, which is part of the small intestine. If immediate replacement isn't possible, a temporary nasojejunal tube may be used to continue medication delivery until the permanent tube can be reinserted. It's also important to monitor and care for the stoma site and surrounding skin. Keeping the area clean helps prevent infection, which can sometimes develop after dislodgement. If signs of infection appear, your healthcare provider might prescribe antibiotics. After the tube is replaced, the Duodopa pump settings may need adjustment to ensure the medication dose is correct. Patients and caregivers should be trained on how to handle the pump and care for the tube properly to reduce the risk of future dislodgement. Securing the external tubing well and being gentle during daily activities can help prevent accidental movement of the tube. Education is key. Recognizing early signs of problems such as leakage, pain, or tube displacement allows for quicker action. Regular follow-up appointments with your neurology and gastroenterology teams are essential to check the tube's function, the health of the stoma site, and the control of Parkinson's symptoms. In summary, if the tube becomes dislodged, stop the infusion immediately, seek professional medical help, and follow their guidance for assessment and replacement. Never try to reposition or replace the tube yourself. Prompt medical attention ensures that your treatment continues smoothly and reduces the risk of complications. Always consult your healthcare team for personalized advice, as managing these issues carefully helps maintain the effectiveness of Duodopa therapy and keep symptoms under control.